Emily Burton. I'm a registered nurse with Mountain Pacific Quality Health, and we want to welcome you to our fourth session of It's Worth a Shot. Today, we're going to go over one of the questions that we had left over from last week around the NHSN and the CVS upload. Then we're going to talk a little bit about vaccine adverse events, and then we're going to finish out the session today talking about burnout, and really want to open that up to some discussion. So we invite you to turn your cameras on today if you want to. We'd love to see your faces. And I'll turn it over to Tom here in just a sec. Any future events that you want to talk about, any educational topics that you're having questions around, please put those in chat. We would love to address those in future sessions. So welcome. And Tom, we'll go ahead and turn it over to you.
Okay, thank you, Emily. There was a question a couple weeks back regarding uploading the CSV files into NHSN. And if I could share my screen, please, Mary. I'll see if I can get a sample of how that works for you. Everybody see this okay? This is the NHSN vaccination summary data page within the module. So the first thing to do in this process is to go to the website, the NHSN website as it pertains to the resident COVID vaccine. And if you scroll down here, there's a section on CSV data import. And what I'm going to do first is what you'll want to do is download the CSV file template. That'll be your first thing. Now I'm going to do an example file for today's purposes. So I'll click on that, and you can see down in the bottom left-hand corner of my screen that it did download. And I'll just open that. And it is just a very basic, for lack of a better phrase, Excel spreadsheet. Now I'm going to change this. I happen to have a test facility loaded on my NHSN, so that's how I'm able to show you this. So I just have to make sure I get the right numbers in here. So we make sure we have our org ID or your facility ID for NHSN. And then we're going to upload this data for the week of February 7th.
I went to settings over there.
Pardon me?
Yeah.
Through the 13th.
Tom, are you sharing, or we're not seeing the Excel file for NHSN? We're still seeing the CSV data import screen.
Oh, I'm sorry. Well, let's try again here. I apologize for that. Okay, here we go. Can you see this? So this is, if you can, this is the CSV template as it looks. Now there are already numbers populated into this. The different columns basically go in the same order as the other forms, the data entry forms that you'll find on the website as well. And it just goes on over to the right, and you'll put the data in for your particular reporting week. Make sure you get the dates correct. Your org ID is correct. And from here, then, I'm going to make sure that I save this. And what I recommend, if you're going to do this, is to create a folder on your computer specifically for these CSV files so that you obviously know where to find them when it comes time to upload them. So I'll just push save. Now I'm going to close out of here. Okay, I'm going to share again. and bring up my, can everybody see my current screen here? And can you see the NHSN page?
Yes.
Okay, this again is the vaccination summary data page. And what I'm going to do is upload the COVID-19 for residents for this particular week. That was the spreadsheet that I just saved. So right down here in the bottom left-hand corner is upload CSV. We'll click on that and it'll say to choose your file. So I happen to know that I have it in my downloads folder because that's all I did was just download it directly to my computer. I click on it and say open. And if everything goes right, it says successful. We say, okay, now if you look up here, the resident file for this week, is all green. It shows that I was successful in uploading the file. And that's really all there is to it. Once you get your data plugged into the spreadsheet and save it down, it uploads really quick. If you have a date incorrect or some things like that, it will give you an alert and tell you what you need to correct. So it's fairly easy to use. And that's all I have for everybody today. I hope that was helpful.
Can I ask a question?
Sure.
This is Maria. So we just kind of had this conversation. So you uploaded it to this week, the week of the 6th to the 13th, but this week isn't over yet. So then if you had to go back and correct numbers because of admissions, discharges, hires, terminations, whatever, then you would reload it, or does it, can you pick the week that you upload it to? You can, right?
What you would do is it reads the dates that you put on the spreadsheet. And that's a very good question, because when I went into my test facility, they already had, they being NHSN, already had data uploaded to this week. So I was able to overwrite that. When I initially went to upload the data, they had the data in there, but it was showing as incomplete. You know, when it's a tan color, that means you're still missing something. So I was able to go over that with the updated data. So I think that as long as you have your same CSV file and you edit your numbers, as you were saying, and save it again, save it as the same, in the same folder, wherever you save those, it should upload and kind of go, it will override what you had in there previously. That's how it worked for me today. So that's how it should work for you as well.
So because I noticed in your training scenario, the week prior was also incomplete. So do you click on that and then hit the upload, or is it whatever dates you enter?
No, actually, here, and I'll share my screen again. Yeah, that's a good question. If I could share my screen again, I'll just show really quickly. So yes, if I were to download another, this is for healthcare workers and it's incomplete, and residents is already in there. If I opened that CSV worksheet again for these dates, for either the residents or the healthcare workers, and I updated those numbers and then just reloaded it into here, that should override. That's how it was working for me today. That should override what you had in there previously. Does that answer your question? As long as the dates are on your spreadsheet, again, just open the same spreadsheet that you initially were working from, and it should reload.
So you don't pick the week and then hit the upload CSV.
No,
just
you don't
hit
have
the-
to do that. You don't have to
Upload.
do that because it reads the data on the spreadsheet. Yeah, you can just go to
Okay.
this page and just scroll down here and click upload.
Okay,
Good,
Yeah, thank
good
you.
questions. Now, if you do click on this, it brings up the form and you can put your numbers in right there too.
yeah.
So there's a couple options on this page that you could do that. Very good questions. Thank you.
Thanks.
Any other questions for Tom? I think we'll move on then and let Kyla talk to us a little bit about some adverse events.
Thank you, Emily. So I'm gonna, in the interest of time, I'm gonna kind of breeze through my slides. But basically, I just want to go over some common adverse events that we can see after vaccines, either in general or some specific to COVID vaccines, and then how we report these and the reporting systems that are available. So the first slide is really just kind of all the things you can see after any vaccine that you get. These are considered mild to moderate, self-limiting, things that can be managed at home. Pretty common to have pain at the injection site, redness, swelling. You can get an injection site reaction, which is a raised, sometimes hard and red, sometimes itchy area, usually at the site of administration. And then fever, headache, body aches, fatigue, and these things can all be managed with at-home pain relievers like Tylenol or ibuprofen. Next slide, please. So this is the list of adverse events that are considered severe. If you look at the CDC and what they're classifying as severe, I'm not going to read through those, but I am going to talk next on the next slide about some of the rates of these severe events that we're seeing with the COVID-19 vaccines. So what we've seen so far in the data that's been collected is that the rate of anaphylaxis is about 5 in a million people. So a fairly low rate. And we are seeing these increased risk of blood clots. And that's particularly been associated with the J&J vaccine. They've actually associated causally 9 deaths. And typically the highest risk age group for this side effect is women aged 30 to 49. And this is one of the reasons that the CDC was prompted to recommend preferential mRNA vaccines for folks because we're seeing the increased risk of blood clots. And then on the next slide, increased risk of the Guillain-Barré syndrome, which is a syndrome that's not specifically associated with vaccines, but it is one of the things that we think can cause the syndrome. So they have identified 305 preliminary cases in the VAERS system, which is the system I'm going to talk about, as of January 27th. So typically the time frame and age group that's more prone to it. Basically, Guillain-Barré syndrome is a rare neurologic disorder, and usually it's self-limiting in most folks, but it can be longer lasting in some patients. And then we're also seeing increased risk of myocarditis and pericarditis, which I'm sure you guys have heard about. This is usually in a younger population and more common in males. And then we have, as I mentioned earlier, seen a few deaths specifically related to the J&J vaccine. Next slide. So these are just the different reporting systems that are available for vaccine adverse events. The one I mentioned earlier, VAERS, and then there's some kind of subsets of that, which VAERS data is used and then kind of matched up with some of these other reporting and tracking systems like the CISA project and the VSD Vaccine Safety Data Link. And then many of you folks may have heard of VSafe, which was something that was started with COVID-19 vaccines. And it's a system where patients can report their side effects that they may be experiencing from COVID-19 specifically. Next slide, please. So VAERS, this is kind of our main system for reporting adverse events. And this is how we kind of identify things that might be happening early with a vaccine and really kind of figure out if they are related to vaccines. Next slide, please. So I want to show you guys a video that just kind of really gives a nice overview of the VAERS system. Oops. Make sure I can share my audio here. Okay, share sound.
COVID-19 vaccines are safe and effective. The Centers for Disease Control and Prevention and the Food and Drug Administration have many safety monitoring systems to make sure every vaccine is as safe as possible. One of these systems is VAERS, the Vaccine Adverse Event Reporting System. VAERS accepts reports from anyone: patients, parents, caregivers, and healthcare providers. Healthcare providers are required to report certain adverse events after vaccination. VAERS studies reports of possible health problems, also called adverse events, after vaccination. VAERS can't prove a vaccine caused a problem, but it acts as an early warning system to help CDC and FDA decide whether a potential safety issue exists. VAERS reports patterns that warn scientists of possible health problems that might need more study. Vaccine safety experts look for unusually high numbers of health problems or a pattern of problems after people get a particular vaccine. It's normal there will be some reports of health problems after people get a vaccination. However, most health problems found shortly after vaccination were not actually caused by the vaccine. CDC closely monitors all data, including reports to VAERS, to make sure all vaccines are as safe as possible. CDC and FDA use other vaccine safety systems to figure out if the health problem is caused by the vaccine or not. If it looks like a vaccine might be causing a problem, CDC and FDA will alert the public, investigate further, and take action. If you want to learn more about VAERS, visit vaers.hhs.gov.
Good afternoon. I'm Commander Ibad Khan, and I'm representing the Clinician Outreach and Communication Activity.
Kyla, if you're talking, you're muted.
Kyla, did you have
Thanks,
anything
Mary.
else?
Sorry, it started to play another video. So we can go back to the slide set. Basically, the next few slides just kind of go through more details of kind of what the video said. So I'm just gonna have us go ahead and go to this one. Yep. So reporting an adverse event. So healthcare providers are required by law to report to VAERS in certain situations. And in the resources slide, I do have a list that they consider reportable events. So you guys can take a look at that. And then it's really easy to report. If you go online, you can either do an online reporting or you can do a PDF, but I've done it myself and it really is a pretty simple process and easy to maneuver. Also links to their site are on my resource slide. And I think just the last one is the VSafe program, which I would have everyone encourage their patients to use this when they're getting their vaccine so that we can collect as much data as we can about COVID-19 vaccines. So thank you.
Sorry, can I ask a question?
Absolutely.
If an employee gets vaccinated and then they end up like getting myocarditis or whatever, and it's like diagnosed by their PCP, who does the reporting? The PCP or us as the people that gave the vaccine?
I would say either person, but just kind of having that conversation on making sure that that process is completed. Because VAERS can be reported by patients, providers, all, and So yeah, I would say that would just be a conversation when you were, talking about the event or identifying the event, that you want to make sure and include everybody and make sure somebody puts it in the system. I would assume that it would be identified as duplicate based on the information that they require you to put in there if it was reported twice, but I don't know the answer to that for sure.
Thanks.
Any other questions?
Thanks, Kyla. So I'm just going to briefly touch on battling burnout. I want to be mindful of your time. We only have about 9 minutes left together today, but I would be very open to anyone reaching out to me directly if there's more information or work you want to do around this. Go ahead, next slide. So I recently watched an interview with a physician, and he discussed our current climate in healthcare, stating that after each wave of the pandemic, kind of as it comes to a close, we kind of see that light at the end of the tunnel, and only to find out that it's actually a freight train coming at us with the next wave. I really felt like that was very powerful and very accurate of how healthcare has felt over the last couple of years. And so what do we do about that? How do we move forward? How do we prepare our teams and our facilities and our culture for these ongoing waves and battling back against this? So really, burnout is characterized by energy depletion, exhaustion, distancing from your job, and then just reduced efficiency at work. Next slide. And really, to be able to start looking at how we are going to address this, we need to look at what drives burnout. So I'm, in the interest of time, I'm not going to read all of those, but I think all of them probably make sense in what you're seeing in your facilities, your staff, and potentially even in yourself. Go ahead, next slide. There we go. So National Academy of Medicine identified 6 domains of evidence-based practices, looking at organizational commitment and really integrating that work into the organization's strategic plan, performing a workforce assessment to get a baseline for where your staff are at. I do have some resources around that, so if anybody's interested in looking at different assessment tools, please let me know. If I could ask one of my coworkers to put my direct email in the chat, that would be great. Leadership, what can we do in leadership? Looking at resource development, improving our systems, and culture development again, looking at different policies. We're in a very different world than we were 2 years ago. So looking at reviewing, revising, and removing those that are creating barriers for our teams. And looking at the efficiency of work environment, are things placed correctly? Is, the printer working? Is it in a good location? All of those little things that really add up to creating a much smoother day for our staff. And finally, support around our staff for culture development, work-life balance, and peer support and coaching. Go ahead, next slide, please. So we really need to look at some of the unique barriers for our nursing homes. Across the country, so many of the COVID deaths have been in our facilities in these, where we have deep relationships with our residents. And so the grief piece that is possibly not being addressed just due to the short staffed and just the absolute exhaustion that goes along with it creates a whole nother level of difficulty for working around burnout. So I have some examples that I'd like to kind of go over, but I also would like, again, anybody that's willing to come on camera and or put in chat any ideas that they've had that have worked for their organization. I think the biggest thing around burnout is really connecting with your people and talking about what might work for them. So anybody you'd walk in and into their area of your facility and ask them 1 or 2 things that would make their job easier. That's a great place to start. We really need to address it from, go ahead and next slide, sorry. We need to address it from a 2-dimensional level of working at strategies targeting directly to our people, but also at the organizational level. And if we don't do both, then it's not going to be sustainable. So Some of the examples for people-directed interventions is making mandatory testing convenient for staff, making sure that you offer it on off hours for those working nights and weekends. And then as they're waiting for test results, if there's any mandatory education or updates, making that available in that area that they're waiting to save time and be mindful of just being efficient. Obviously, obtaining and maintaining sufficient PPE supplies, making sure that those are readily available. Also talking to staff about how to keep their families safe if they're caring for COVID positive residents. Establishing backup processes for emotionally challenging situations, including debriefing sessions before the end of shift, not waiting till the next day or the next week, but actually addressing it real time. Keeping the staff updated, centralizing education and updates, whether it's a bulletin board or in the break room. One of the most effective things that I've heard is just leadership presence and rounding. Staff want to know that they're being supported, and there's no better way to know what's going on and what they're facing than to be out there with them. And I know that the demands on leadership is heavy, but that has been a recurring theme over and over as I've done this work. So that can start with like a daily huddle, starting with a positive message, not positive gossip of, things that are going well, people that are going above and beyond, somebody that maybe came up with a new process or a quick quality improvement project that was a easy, quick fix that's going to make people's lives better. So around some of this work, one of the terms that people will use is, what is the pebble in your shoe through your day? And often it's something, like I said, very simple, like a printer issue, like the fax doesn't work or something like that, that might be fairly easy to fix that would make their job better. So again, optimizing technology. If you're using an EHR, looking at if there's any clicks they can avoid, is there something you can redesign with an IT team to make their charting and or process flow easier? And then offering professional development for like the patient care attendants and the CNAs to kind of look at some of those staffing issues down the road. You can also strengthen partnerships for future staff with local colleges, nursing schools, that type of thing, as well as your local hospice. That can have a dual purpose of having them help out with some of that grief work for the residents and their families, but also for the staff. They can sometimes help provide some of that debriefing, as well as involving EAP if that's a possibility for your facility. And then maximizing staff working at the top of their license and cross-training, designating a quiet room that staff can visit for privacy and stress relief for this shift. There's one example of a Hoag Memorial Hospital out in California. They actually do a lot of work with virtual reality for their patients for stress management, pain, and education. And they turn that technology towards their staff during this. They actually sent kits to their staff's homes with virtual reality interventions, mindfulness, and also education sessions that they were able to complete. And it decreased the staff's feeling of stress by 34% in using that. So next slide. And unfortunately, I could talk about this all day long, but I really would encourage you to please reach out to me if you want to do any work around this, if you need any resources, if you have anything that's been a good intervention that's worked well for your facility. We love to share those with other partners to give everyone a little bit of hope. We have a lot of power of connection through us here at Mountain Pacific. We're bringing teams together from, Alaska, Hawaii, Montana, the US Pacific Territories, and Wyoming, Montana, if I didn't say that. So it's a really unique opportunity to take advantage of us and network and brainstorm and connect to improve some of this for our facilities, for our staff, for our leadership. So thank you for your time. And I see Maria has something in the chat about next week being Random Act of Kindness Week, and I love that. Thank you. We also have a link in the chat for our evaluation, and we will be back here at 2:30 next week. We really appreciate you taking the time to join us and look forward to hearing from you if you have any ideas for future topics. Thank you all.